Hi everyone, Dr. Max here for our third DNS Facebook Live. Today I'm going to go over how DNS can be utilized to help your athletic performance, whether you're a top-end, high professional paid athlete, or if you're just a weekend warrior just like most of the rest of us. Whether you're somebody who's in peak physical shape in their 20s or somebody in their 40s, 50s, 60s, 70s, even 90s who wants to be able to stay fit. DNS is the therapy system, is the exercise warm-up, at least, system that you can use to keep you staying fit and relatively injury-free. Obviously, I can't make any promises because people are going to do all kinds of crazy things when they exercise, and DNS isn't necessarily going to be able to fix that. But DNS can make sure that you're only using the muscles that you're intending to exercise, not overcompensating. Which leads me to the first topic of the night, why people tend to get hurt. Generally speaking, most athletic injuries are chronic overuse. Most people know that. If you don't know that, there's your first fact for the day. But that begs the question, how do you get chronic overuse? And why do some people have overuse injuries when other people don't, when they're two people doing the exact same exercise? I'm glad you guys asked that. The reason why is because it's a difference of joint centration, reflexive stability, and postural control. Now, those are the core principles that DNS works or takes people through in order to help them to be able to basically maximize their athletic performance. An example being that this week I have, for my patient population, I have generally geriatric patients. A couple of times I get a few athletes and younger high school age, college age people coming in here, and it's a system that can work for everybody because it is based off of how everybody developed. So today I'm going to go through a quick demonstration of how the next progression, because if you've been following with me, I've been going through what DNS is and then went through initial, work that I take people through. Now we're getting into some of the more advanced maneuvers that we do. So this series is, like I said, intermediate level performance. This is where in my rehab program, this happens after we've established a baseline, or established the core foundation skills, making sure you're doing the belly breathing, making sure that you're bracing appropriately. Then we've done some initial phases. After all, DNS works in a progression where it's going from 3 months to 12 months, following specific positions that you can see on the posters behind me, which one of these days later I'll make a video going through each one, or video series going through each position. For now, I'm just going to show you something that I have a lot of my higher performers utilize, as well as people who, once they get in that specific progression, then work towards. Now, the sequence here is going from laying on your back to laying on your side to coming up in something called bear position to going into tripod position. Now, that's the technical terms is to go from DNS 3 month to DNS 4.5 month, 4 month to DNS 5 month, to DNS 5 month sideline, to DNS 6 month low oblique sit, to DNS 7 month high oblique sit, to DNS quadruped, or DNS 9 month, to DNS 11 month in the bear, and then DNS 11 month in the high kneeling. So because most people who are going to be watching this don't speak DNS, I'll try to keep this in simple terms. But if you have problems with that, leave a comment below or just shoot me a message to let me know. Now, this is a exercise routine that, like I said, is for the more advanced. So if you have not been working on this, please do not try this at home without supervision from either myself or somebody in your area who does DNS, because I don't want you getting hurt. And plus, you're not officially my patient, so I take no responsibility for your actions. Now, the way that we do this is, first things first, as always, start working on the belly. And I hate that you can't do horizontal in this, but Belly breathe here for a little bit. Get yourself warmed up for your warm-up. Then we do the 5 month. Okay, so now, you remember from last week, this position is 3 month, this position is 4 month, the difference being I'm rocking my hips back more. Again, 3 month, 4 month, then we go to 5 month, where again, rocking my hips back more, changing my center of gravity, so that way it's easier to then roll on our side like this. Now, this is a position, this is 5 month sideline, that is great for any kind of, let's go back some more in shot. That is great for any kind of shoulder issues or hip issues, because from here, you can work on rotating around these support points, right here and here. This helps you to perfect your joint centration and make it so that way then you're getting your shoulder and hip respectively centered in your socket, so then you want to do something like throw a baseball or lift up a weight, or be able to turn a screwdriver, put together your kid's high chair, just do anything along the nature that involves either shoulders or a lot of knee pain tends to stem from hip weakness. Then you can use this position to help with that. Next, if you want to get more advanced, then we come on up on our side like this. Again, the way we do that is come up here, then you can lift up and go all the way into all fours. This here is something that most of you who deal with carpal tunnel are going to not appreciate as much, but if you go ahead and do or if you want to effectively do your cat-cow exercise, then you'll want to get good in this position. Then, most of you who are watching who are going to be more advanced weightlifters or just at higher level athletes will already know this position. For those of you who are newer to this, this is called the bear position. Come on up like this, on all fours, and you crawl around. Again, great way to work on core stability. Then the last one is coming in tripod. I'm going to be facing you guys this way because I'm going to go ahead and turn around. So, what we do here is, sorry I'm out of the shot. Start out here like this, on our back. Roll onto your side. Come on up, like so. Then here, then here. Then go in here like this. Then bring a foot up, an arm like this. Then from here, you can practice your lunges, basically, before you're doing your lunges. Glide forward, backwards. Forward, backwards. Again, great way to work on joint centration as well as core stability. Sliding off a little bit. There we go. That's better, Dr. Max. Let's see. I got somebody who wants to join. Oh well. Sorry, Peg. Sorry. Can't hand you join. But, yeah, we're here. Gliding back and forth. Just like this. And you can do that going the other way, too. Where? Again, start off here on your back. Roll over onto your side. Plant your foot. Come on up. Lift yourself up, down like this. Bring this foot forward, and then bring this foot forward, hit this hand, come here. And then sliding back and forth. Do it likewise, going the other way. Now, like I said, this is primarily for people who don't do any of these at home if you feel like there's any risk of you injuring yourself. But this would be an extremely great way to be able to help you with knee pain, with chronic shoulder pain, especially when you're trying to lift your arms up over your head or trying to reach anything up overhead. these moves are going to be really, really, really great to help with something like that. For my chronic knee pain sufferers who are out there, these moves are going to be extremely great for helping you to get strength through your abductors, as well as center your hips correctly, so that way your brain stops saying that your knee should act like your hip. This will also be a great way to help with ankle control, help with wrist control, so then people with chronic elbow issues can stop having them because your elbow is being forced to behave like your shoulder or your wrist. Now, I gotta run because it's Memorial Day weekend, but I hope you guys appreciated this. If you guys have any questions or comments, please, well, obviously comment because it's a Facebook Live video, but send me a message. I'd be happy to reach or to contact you guys. If you're watching this on Facebook, leave a comment. I don't think Facebook lets you do personal messages, but if nothing else, have a happy Memorial Day and give DNS a try.